can you explain to our audience what the triangle of health is? Because it's a big part of how you practice, I believe.
Absolutely. So it's really important to be able to look at a whole person, and the way I think of a whole person comes from that triangle of health. And there's three aspects of that triangle. One is going to be physical.
Okay.
One is going to be mental, emotional, and one is going to be biochemical, meaning like what's in your external environment, what's in your internal environment, whether that be chemicals and metals, things you're exposed to, or the foods and things like that that you eat.
Okay. So in this triangle of health, can you give us an example so it's a little more understandable for the viewers?
Absolutely. And this is something that I feel really passionate about. I love sharing this with people because it's so important to understand in your own life, because in my experience, all symptoms come from one of these parts of the triangle. So for example, the physical aspect, let's give an example. So say, for example, somebody's in a car wreck and they hurt their leg, or they break a leg, or they have something going on. And so when you have something physically go wrong with you, the thing that's going to be most helpful for you is going to be an actual physical adjustment or some sort of physical interaction with the body. So that could be acupuncture, chiropractic, physical therapy, massage. There are a bunch of different systems that you can use to focus on the physical. And so by working on the physical, you're going to get the best results with the physical. Then there's going to be the biochemical component. So biochemistry, or the external experience and or the internal experience, might be something that you're eating. For example, maybe there's a food that you're allergic to, and or the way in which the body breaks down or doesn't break down that food changes the internal environment. Again, you know, we live here in the Pacific Northwest where people, for example, work on submarines where there's nuclear radiation. Sometimes people don't do well with chemicals and metals, some sort of, like maybe like a pesticide exposure, those sorts of things.
Allergic reactions.
Allergic reactions. So that changes the biochemistry, whether outside or inside the body. And then the last one is personally my favorite, and that's going to be the mental emotional piece. And the mental emotional piece is how are we dealing with our emotions? How are we dealing with kind of our underlying subconscious brain, the programming that we had as a child? How do we deal with our personal emotions? Are we processing them both in the present and or the ones that are affecting us from the past? So maybe a stressful event, maybe in that car accident.
That car accident.
The car accident. So for example, maybe every time you get in the car now, you go back to that car accident and you've got that kind of trauma. You tense up, and your body, your physiology literally recreates what happened in the car, and it creates a lot of mental emotional trauma and issues, and you become dysfunctional.
So in that triangle of health, in the car accident example, you break a leg. So that's the physical part, and you have to figure out how to heal it. You know, is it something that can be reset? Does it have to have surgery? When you talk about the bio part, then if somebody isn't able to walk around the way they normally can, then what they're putting in their body, maybe their diet might have to change because they're not getting the physical activity they normally would have gotten. Then that might not help if they're gaining weight with the recovery. And then you've got the mental behavioral part of it too, the emotional part. How do they feel not only about maybe getting back into the car, but, you know, having that disability for a little while, and maybe nightmares from, I don't know what kind of accident it was, let's hope it wasn't a bad one, but all of those that play into this, and how the recovery of that person. Is that true?
Yeah, absolutely. And the one thing I'd like to add on top of that,
yes.
Oftentimes, for example, if it's a simple injury, right, so maybe it is you just broke a leg, or you hurt a hip, or pulled something, and you go in and you can get physical therapy done, and maybe that goes away, right? Oftentimes in simple cases, the pain will go away, for example.
Okay.
But in really difficult cases, which is mostly the types of people that I see, usually there's more than one side of the triangle that actually needs to be affected in order for the person to actually experience change. So sometimes maybe the mental emotional piece needs to be worked with in conjunction with the physical therapy in order to break the pattern that that person now is in. Or sometimes they need all three, and that's where people tend to have long-term problems. and that's going to be where the complexity happens, where you really have to look at the whole person. You have to look at all three sides of the triangle for people in complex situations so they can get better.
And it sounds like really, no matter how, I don't know how you would say it in medical terminology, it could have been a break that wasn't so traumatic, you know, but it doesn't matter how traumatic it was or not. It seems like in any situation, any patient that you work with, really the triangle should come into effect, and for the most part, all sides are usually used, but some might be used more than another. Is that correct?
Absolutely.
So, as a naturopathic doctor, and using the way that you like to practice this triangle of health, how is that compared to what people call their primary physician? What's the difference there between a naturopathic doctor and a primary physician?
Sure. So in the state of Washington, I am licensed as a primary care physician.
Okay.
And so through our training, we kind of focus as a primary care the last 2 years of school, where traditional medical doctors might go and round with all kinds of different specialties, for example. We focus on just being primary care physicians. Well, we focus
being naturopathic doctors.
Naturopathic doctors. Our training is to be a primary care physician.
Okay.
That is our primary focus. Now, many of us will focus on specific things as we go out. So some of the additional training that I've had has me focus on additional things. But the difference from a traditional primary care physician is going to be in their training and kind of way that they look at the body versus the way that I might look at the body.
So they might only be looking at one side of the triangle, more of the physical for the most part.
Right.
They're not looking at the emotional side or necessarily the biochemical side.
Right.
Okay.